All right, kinesiology 223. Here we are in chapter 21. Still talking addictive and unhealthy behaviors. This is now presentation 3. We are going to revisit a couple things from the previous presentation regarding substance abuse, and we'll get into drug categories, effects, and professional role in detection and preventing. All right, let me get myself out of the way. This is what we talked about a little bit before in terms of a maladaptive pattern of psychoactive substance abuse includes these things, and then a persistence of symptoms over at least 1 month. So, if we meet these classifications, then we get into um, the actual conversation of, all right, what are the drug categories and effects? We're seeing this type of behavior out of our athletes. What are the drugs that they are using and what are the effects therein? And then what is or are our responsibilities and what is our role in detection and preventing substance abuse? So there's four main things that they talk about here. It's the prevalence of substance abuse, the reasons the athletes are taking the drugs, which we talked about. Now we're getting to the categories and their effects and the role of detecting. So we've kind of gone through two of the four in this list. So let's jump into categories and effects. Let me get myself out of the way here a little bit. Performance enhancing drugs be one of them. Recreational, social, or street drugs is or are another. And then pain relievers is the third main one. And I kind of talked fluidly back and forth in the last presentation regarding how some recreational drugs are used for social, and some of those drugs are also used for abatement of pain. But when you look at performance enhancing drugs, these include anabolic steroids, beta blockers, and stimulants used by athletes or exercisers to increase strength and calm nerves or block pain. There's 6 main categories of performance enhancing drugs, and they talk about these performance enhancing characteristics and the side effects therein. Now, if I click here and move on to the next one, with this, the 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 book lists several of these, and they list these in this nice kind of concise little table here. I'm going to myself all the way, and they talk about the drug category in the first column being stimulants, narcotic analgesics, anabolic steroids, beta blockers, diuretics, if you want to be precise, and peptide hormones. I will let you pause me here and you can kind of review these, but you have to understand that there's different reasons why you would use these different drugs. And what it comes down to is this column here in terms of what are the performance enhancing effects. Well, you want a little bit of coffee to help you not become fatigued, that's fine. Pain reduction for analgesics, anabolic steroids to get stronger, maybe improve your endurance capacities, etc., etc., etc. So maybe take a moment or two to become more acquainted with these. And I don't think you see them too much later on, but I think there's one question or two questions later on specific to these. But it's good to kind of wrap yourself around these and have an understanding of the desired outcomes or the outcomes of these, because usually that's what drives the desire to use them. Let me get myself out of the way here. All right, so we go recreational, social, or street. They revisit this topic from earlier in the chapter in terms of recreational drugs. These are the drugs that are most widely used, and they're usually used for personal pleasure, managing stress, or managing pressure. They can also be used by thrill seekers as well. But the big thing that you have is individuals might, drink, smoke marijuana, or use some other drugs for the simple fact of reducing stress. Now, the pain relievers, the analgesics, these when you read this in the book, they talk about non-steroidal anti-inflammatories, but we did have the opioid epidemic, and that was very much all about pain-killing drugs. And you'd have doctors that would just prescribe Oxycontin or oxycodone and Vicodin as a way to abate or offset pain because of training or because of injury. And as a result, they became very um, easily accessible drugs to get your hands on. And they were also found to be incredibly addictive. And there's plenty of research on this. And there's also several really good television shows and kind of um, movies that are on this topic. and how it just kind of overtook the country. But it's abated a little bit now. Now, when you talk about adolescent athletes, and you have a study here of 1,500 athletes, they found that male adolescent athletes who participated in competitive sports across the 3-year study um, had 2 times greater odds of being prescribed painkillers during their previous year and had 4 times greater odds of misusing painkillers. And so you have this case where doctors were basically over-prescribing these medications, and it was an awful situation for these student athletes, or the athletes in general, as well as just society in general. I'm going to move on. I'm kind of getting on a soapbox there because I'm getting a little irritated. All right. The use of e-cigarettes to replace smoking cigarettes has increased, and it kind of backed off a little bit over the last couple of years. Although they appear to be less harmful, they still have the habit forming properties, and they promote addiction to other drugs. But e-cigarettes, you're still inhaling something into the lungs. You're inhaling chemicals. Many times it's an oil-based product, or it could be a vapor-based product, or it's called vaping. That could be like just water, but you're inhaling into your lungs a substance, and it can be an irritant that can cause coughing, chest pain, nausea, throat and eye irritation, and then also long-term could be bronchitis, lung infections, and lung cancer. And you need your lungs to be able to service the needs of the body during competition. You got to suck oxygen in, you got to exchange it across the alveoli, and you got to blow off CO2. That all happens in the lungs. So both smoking and, whether it's pot or cigarettes, I'm just going to say, and or vaping, they're poor choices for athletes, just because of how much you need your lungs to function correctly. So with substance abuse and our role as professionals, right? As a coach, you may need to intervene. You may have to actually say, look, I've noticed performance changes. I've noticed your behavior. And, you may have to actually pull an athlete aside if they're exhibiting any kind of abuse-like behavior. Now, to actually perform drug testing is a little different animal. It's invasive. It costs more money. There's some schools that are within the Catholic League here in Chicago where they do hair testing, which is just part of being at in their schools. But most public schools just won't do that. And when you talk about these different things that you look at, you can look at the different signs and symptoms, and here they are in a list. I'll let you kind of pause and read through those. But if you observe these in your athletes, it may not be the case that they're substance abusers. They could have other problems going on, psychological or emotional. So, you have to kind of navigate a real touchy conversation to be able to get to the root cause of some of these issues that are here. And it's not exactly easy to pull an athlete aside and say, hey, by the way, I notice your performance is dropping here, or I'm seeing this is happening here, because your athlete might not want to be fully forthcoming with the fact that they're a big pot smoker, or they're drinking, in the parking lot before they come to practice. They might say, well, I have other things going on with family and friends, and you might have to get a little bit invasive with them in terms of like what's going on to get to the root cause. And it might not be a comfortable conversation, just saying. Okay, so rationale for anti-doping policy. It lies within the legal aspect of it, the ethical aspect of it, and the medical aspect of it. So from the legal side, we're talking about specifically state laws and federal laws that ban certain selected substances, and they legally are not to be possessed by individuals, and they can be classified as a felony for possessing these types of substances, and depending on the amount, right? If you have certain medications that you're taking illegally that were prescribed to somebody else, and you're taking them because you've bought the pills off them for $5 a pill, that's a very illegal practice. Also ethical and medical as well, because you're taking somebody else's medication. But from the ethical side, we have the integrity of the sport. We're talking about doping, and it takes away from fair, competitive environment. And many times people who are involved in doping and taking drugs could care less about the ethical side, right? They can compromise the ethics to be able to get the outcome. From the medical side, um, prolonged doping can cause harmful long-term effects, both physically, right, and can cause other issues in terms of psychological. Now, that depends, right? Depends on the drug that's being taken. It's also depending upon what the desired outcome is. And when when they evaluate the risk reward scenario of if I take this drug and I win the Olympics, well, they might not be as depressed as one would think, right? But if they take they take the drugs and they're doping and they don't win in the Olympics, then you might see that depression, then you might see that aggression. But the other stuff, sure, your body has to process everything through the liver. You could end up with some type of liver cancer or loss of function or low function for your liver. You could end up with some type of cardiovascular disease if you're smoking whatever it is you're taking, or depending upon whatever you're taking, it could cause sterility. So, there's different reasons you have for limits in terms of the moral, ethical, legal, and medical components. But you got to understand that some people, if they're eager to perform and they want to do well in a particular sport, they may not care about the legal aspect. They may not care about the moral, ethical side of it. And they may not even care about the health effects of taking certain drugs or medication. So ultimately, you're dealing with somebody who's so task focused and so outcome focused that they're taking these illicit drugs to enhance their performance, not even caring of the end game outcomes of it. And very much these individuals live in kind of a bubble of denial and they could care less. And you as a coach may have to pierce that bubble to get to them to have a conversation regarding the legality of what they're doing, the moral ethical component of what they're doing, and the health effects of what that person is doing. For some, it'll be easier. For others, it'll be very difficult to reach that person. I'm going to leave it right there and move on to the next one.